Welcome to Dad Talks. Today in the studio, we've got someone extremely special because she is the flag bearer, the pioneer in her field. Rashida Juzer Ali, talking about something that you had no idea about. It's called Airway Dentistry. Dentistry सुना था, teeth whitening सुना था, भाई ये कुछ और है. Welcome to the studios. How are you doing?
Hi Tarun, thank you for having me here. I'm doing good. How are you?
You're more than welcome. I'm so excited to deep dive into this subject with you. First of all, Rashida, could you please tell me what is airway dentistry and how are you the flag bearer and pioneer in this field?
Sure. So I'm the first American board certified sleep apnea specialist, airway dentist in the whole UAE. I'm also one of the pioneers of neuromuscular dentistry in India and UAE, and I have recently become a president of ICMO, which is International College of Craniomandibular Orthopedic in Middle East.
इतना सारा बोल दिया आपने. ICMO क्या है? ICMO. So what is this?
It's an organization that teaches us to be a neuromuscular dentist. In fact, right now, the only organization in the world. So,
Wow, okay.
yeah, I'm honored to be the first president of the entire Middle East.
Dude, that's incredible. Wow. And you've become the president of it already.
Yes.
Well done. That's
Thank you.
exceptional.
And I'm also the first American board certified sleep apnea specialist in the entire UAE.
That's incredible, and it's such an honor to have you here in the studios talking about something that we dads must be concerned about. Now let's deep dive into it. When it comes to airway dentistry, when it comes to the subject that we are talking about, how does it affect a child and how can we figure out a solution to it?
Right. So before we begin, I would like to ask you, how are you breathing right now? Through your nose or through your mouth?
Through my nose, I think.
Right?
Yeah. When I'm talking,
Okay.
I think I'm exhaling through my mouth, but I normally breathe through my nose.
Right? We normally breathe through our nose, and that's the right way of breathing. But when the kids starts to breathe from their mouth, either occasionally or constantly, then that's something to worry about, and that's something that needs to be checked as soon as possible. Because if it's not treated on time, then it can lead to a variety of serious health conditions. So first, why does a child mouth breathe? There can be many root causes behind that. The first being a tongue tie. Now, what is a tongue tie? Tongue tie is basically a tissue that attaches your tongue to the floor of the mouth,
Yeah, yeah.
right? Sometimes that is shorter or tighter than usual. So if it is shorter or tighter, it basically limits the movement of the tongue.
Okay.
And the tongue is responsible for the growth of the entire craniofacial region. So when
Craniofacial region is the jaw?
is the jaw,
Okay.
exactly.
Because
And
हमको है ना
there-
इतने बड़े-बड़े words समझ नहीं
Right,
आते.
I understand. So when your tongue is not working properly, it's not basically growing your jaws properly,
Okay.
right? And it's lying low in the mouth.
Yeah.
When your tongue is lying low in the mouth, the child tends to become a mouth breather, taking a lot of air from the mouth rather than nose. When you're breathing from the mouth and not through the nose, you're taking a lot of unfiltered air, which has a lot of bacteria and viruses, let's say. And that's how the child actually falls more sick. So, you know, many of the times you see kids having problems like tonsils and adenoids inflammation. So that's not a disease in itself. I would say that's a symptom that's caused because of mouth breathing.
Oh wow, okay. And mouth breathing ka major reason is only being tongue-tied or there are other
No,
reasons too?
there can be many other reasons, like for example, deviated nasal septum or having any sinusitis or nasal polyps, or you know, any infection where the child is forced to breathe from
the
the
mouth,
mouth.
okay.
Yes. I'm also going to talk about the deviated nasal septum because, you know, I see a lot of adults are suffering from it and they don't know how does that happen. So to put it simply, when your tongue is lying low in the mouth, ideal way of the tongue should always be touching up against the palate. Where's your tongue right now?
On the top
On
of
the
my
top.
mouth. Yeah.
Okay, so that's the ideal
Yeah.
tongue position. But people who are mouth breathers, when their tongue is lying low, so what happens? The upper jaw does not develop fully. So it becomes like narrow and high vaulted. And the roof of the mouth is the floor of the nose. So that if that becomes high vaulted, then your nose does not get enough space, so your septum becomes deviated. So actually the reason of the
Everything is related to
everything in body is related to each
and
other.
that is so cool. Now,
Right.
see, when it comes to a parent, right?
Right.
We're talking about kids majorly
Yeah.
here. And the early years of symptoms, when can we see it? And
Right.
how can we see it at home
Right.
without going to a doctor?
So the early symptoms of mouth breathing is when your child is sleeping with his or her mouth open, if the child is snoring or having trouble sleep. Also certain symptoms like if the child is hyperactive, not able to concentrate, or moody, irritable, or having any speech difficulties or learning difficulties. So this all can be actually related to mouth breathing. So the most important thing is, if the child is mouth breathing, you have to show to an airway dentist to recognize these symptoms early and to treat them. If the child has already have got teeth in his mouth, so we need to look for the gaps in the teeth. If there are no gaps in the primary teeth, then that's something to be concerned about, because that talks about a narrow jaw. Narrow jaw also is responsible for sleep apnea later on, and a lot of other health issues which I'm going to talk about.
Okay.
So these are the signs that you need to look for. If the child is mouth breathing, if the child is snoring, if the child does not have gaps enough in his primary teeth, if the child has any difficulty learning, difficulty in speech, or any behavioral issues.
So this all are the symptoms of mouth breathing.
Mouth breathing and sleep breathing disorder.
Sleep breathing disorder.
Yeah.
Okay. Now this is something that the parents can look at home and figure out.
Right.
There are things that perhaps, are going fine, but again, they would lead to this. So what would be the right age for the parents to come and see you?
At any age, when you see that your child is suffering getting a good night's sleep. So whether a child is a month old, a year old, or 5-year-old. If the child is breathing through his mouth, it's just not normal. It needs to be looked at any age.
Talking about, there are symptoms, there is this issue that parents are dealing with now. They've come to you.
Right.
Could you please tell me, how are the remedies? Are there rectifications to it, or ki ek baar ho gaya to fir it's irreversible?
No, absolutely there are remedies. In fact, so the first thing that I would like to look at is the root cause. As I just said, that one of the root causes of the mouth breathing can be a tongue tie, so we need to rule that out.
Okay.
The other root causes of mouth breathing also can be because of not getting enough breastfeeding.
Breastfeeding.
Breastfeeding is extremely crucial for the entire development of your entire craniofacial region, your entire arches.
So when it comes to breastfeeding and a mother can only feed till 3 months or 6 months, is it not good enough? Like, how does it work?
Well, yeah, it's not optimum. I know a lot of doctors say that 6 months is optimum enough, but as an airway dentist, now we know that the right amount of time for the breastfeeding should be minimum 2 years. Because the way your tongue is suctioning up against the palate through the breastfeeding, it's growing your jaw. Versus if it is not getting enough exercise, if the tongue is not getting enough exercise, the jaw does not grow optimally.
But hang on, is it different than bottle feeding then?
It is quite different.
The structure, the palate, like how?
So, as I said, the suction, the mechanism of how the tongue suctions the milk through breastfeeding is very different than a bottle feeding.
Oh, okay.
The pressure is a lot more when the child is breastfeeding, and that's why that amount of exercise is needed for your jaws to grow.
Oh, wow, dude.
That's
everything is related, and it's so wonderful and fascinating.
Everything in your body is related to each other. You know, there's no isolated part in your body. In fact, you'll be surprised to know that when I'm looking into sleep breathing disorders in adults, let's say, or TMD issues, which is a temporomandibular joint disorder, I'm also looking at their posture. I'm looking at their toes. I'm looking at their entire, when they stand, how their shoulders are level up, how their eyes are level up, where their hands are, if they have any problems in their hands and toes, like numbing, and they're like so surprised. They're like, how is it related to teeth? I'm like, everything in your body is related to each other.
Oh my God. Okay, so here's the thing. When you look at me, do you think I have any of those? Because you said you look at them and you figure it out. Batao, mujh mein kya kami hai?
Well, not really. Your teeth looks pretty good to me. Your jaw looks pretty grown. But of course, I mean, I need to see it in the mouth to
properly examine everything.
Properly examine.
Okay, I'm definitely taking an appointment and coming to you. Where is your clinic exactly, and what is it called?
It's called Lidente Dental Clinic.
Lidente
Dental Clinic. It's opposite Wasl 51. It's on Al Wasl Road.
Okay.
Yeah, and so we have built the entire ecosystem in our clinic to basically diagnose these issues. So it's a very airway focused and a neuromuscular focused, one of the kind dental clinic in whole UAE.
And it's in Al Wasl, so it's quite centrally located. So
it is, yeah.
Okay, madam, appointment kaise milega? So do I go onto a website, or do I call the clinic? How does it work?
I'll give you the number.
Okay.
056-828-3332.
Okay,
That's
zero
my
five
kid.
six eight two eight triple
Triple
three
three two.
two.
So the last is 32. It's
32.
a
Okay.
teeth, yeah.
Batesi. Okay. Okay.
Right.
So definitely getting in touch with the
Right.
people, and I'm bringing my daughter as well because I
Sure.
just want a regular checkup done because I
Absolutely.
don't want to wait for a long time and then realize arey kuch hai.
Right.
So a normal consultation would be good as well.
Yes.
And I'm definitely coming to you. Thank you so much for all the expertise. Now
Thank you.
let's go to dads.
Yeah.
Okay, we talked about the children, the things that can be seen and can be rectified. Now people have
yeah.
breathing issues,
Right.
they have snoring issues, they have sleep apnea. पहले तो sleep apnea होता क्या है?
Okay. So sleep apnea is when a person stops to breathe for at least 10 seconds or more in an hour. Okay, most of the time it is confused between snoring. Now snoring can be just one of the symptoms of sleep apnea. It may or may not be associated with sleep apnea, but sleep apnea is more severe. It actually, if it's not treated, it can have a variety of serious health conditions like high blood pressure, diabetes, other metabolic disorders, sometimes even stroke and heart attack.
Oh my God.
Yeah.
That's sleep apnea.
That's sleep apnea. Yeah.
And how can that be rectified?
So first we have to
Diagnose it.
yeah, we have to dive into the root causes. If you have a narrow jaw, it's like, if I would like to use an analogy like having a smaller garage and a bigger car. So car being your tongue and garage being your arches. So if you have a smaller garage, of course the car is not fitting, your tongue is not fitting, so it's going to fall back at night and it basically chokes or blocks the airway.
Okay.
So the biggest reason, that's why I emphasize a lot for kids, for them to have proper big arches, because they're developing into an adult, and if it's not rectified at a young age, then the adult can have problems like sleep apnea
And
issues
is
like
sleep
that.
apnea rectifiable as well, or is it irreversible?
It is. Depending, of course, there are three types of apnea. One is obstructive apnea, complex apnea, and central apnea. Obstructive apnea is where there's an obstruction happening at the airway.
Okay.
And we need to look into where the obstruction is happening. In fact, 70% of the obstruction is happening around the oropharynx, around the area behind your tongue. So if the root cause is, let's say, a tongue tie or a narrow jaw, that can be rectified. In fact, nowadays a lot of people are seeking dentist help for their sleep apnea issues. If you do not have any nasal polyp or nasal obstruction, then this is
the only way.
This is the only way to look at. Yeah.
Oh, that's quite incredible. I think you were going to say something about the kids as well when I interrupted you. Can we go back to that?
Yeah, I was actually going to talk about why is nasal breathing so important and what happens physiologically when you're mouth breathing. So when you're breathing from your nose has the filtration system which your mouth does not. Also, in your nasal sinuses, there's one very powerful molecule called nitric oxide, which is not present in your mouth. Now, nitric oxide is basically responsible for the absorption of oxygen, and it also acts as a first line of defense against all the germs like bacteria and viruses. So if you're breathing from your mouth, you're actually falling more sick. Whereas when you're breathing from your nose, it's protecting you. It's also humidifying the air, it moistens the air. So the absorption of the oxygen is better when you're breathing from your nose. And the nitric oxide is also responsible for transporting the oxygen to the different tissues in the body, especially to the brain. So when you're sleeping, oxygen is very crucial. Sleep is not a passive state. It's a highly active state of rest and repair. And in order to restore the body, your brain needs oxygen. Your brain needs oxygen for, making all the good hormones, growth hormones. And imagine if the child is having a mouth breathing, not getting enough oxygen, a brain is deprived from a good oxygen, and a child is deprived of all of these good effects,
Yeah, the fuel is not reaching the station. Let's talk about the garage analogy again.
Exactly.
Because if the fuel is not reaching, the factory is not working. If it's not working, the growth is being hampered.
Absolutely.
Wow, dude, it's quite fascinating how beautifully it is related.
And that's why what we see is kids who have mouth breathing, they have a lot of variety of neurocognitive behavioral issues, in fact often diagnosed as ADHD. So kids who don't get good enough sleep or good quality sleep and good oxygenate sleep, they have a lot of bedwetting, they have speech difficulties, they have learning difficulties, and the brain development gets impacted. Their entire even face development gets impacted. They have a long narrow face. They have venous pooling around the eye, what we call dark circles. It's not normal for a kid to have dark circles.
It's not.
It's not, yeah.
No, but it's very, very interesting to all the parents out there. Let it be you who's going through a similar scenario like ADHD, perhaps not waking up groggy. I'm pretty sure that is a part of it because your brain is not getting enough oxygen. Then this is something that you must, look into. Get a consultation, meet someone who is an expert, meet her if need be, because, it is leading to so many changes around everything in your life.
Absolutely.
And that's why a proper sleep is so important while you're breathing through your nose.
Right.
Well, if there is any tips or suggestions, Rashida, that you would like to give out to parents in current situation, the lives that we are living, what would those be?
So first thing for all the parents, if you have a newborn kid, I would like you all to assess if the child has a tongue tie. So the right way to assess is if the child has difficulty latching or the child has a difficulty in breastfeeding. Most of the time, mother starts to feel guilty that I'm not producing enough milk, but actually the problem lies in the child's tongue. So if the child is tongue-tied, it's a feedback loop. If the child is a tongue-tied, the mother automatically stops producing milk. So that is the one thing to look out for. The other thing to look out for is if child is having trouble learning or any speech difficulties, or just a very simple test, if I would like to say, is when your child is sleeping, just very gently put the chin down like this and just see where the tongue is. If the tongue is touching up against the palate, which is a right way, that means it's all fine. If it is not, that means if the tongue is lying low, then you may have a tongue tie and it's better to get it checked.
So if the tongue is touching up and I pull my chin down, this sound would come?
This sound would come, yes.
Okay.
This is what we are looking for when the child is sleeping.
And if the tongue is down, then obviously there would be no sound, and that means you need to come to you.
Exactly.
Okay, and any suggestions for, dads? Who like मैं तो ठीक हूँ. Thank you. But I need a proper examination. I'll come for that for sure. But to all the parents out there, let it be dads, including mums. You are the pillar of everything that is happening in our lives. If there is one suggestion or tip or self-analysis, diagnosis that they can do to know if they need to come to you, what would that be?
If you're waking up with a dry mouth, because most of the time you don't know if you're mouth breathing unless your partner observes that. Or sometimes you don't even know you have sleep apnea because, as I said, snoring is just one of the symptoms. You may or may not have that symptom. But if you're feeling excessive daytime sleepiness, you're not able to concentrate at work, you're irritable, you're fatigued. So these are again the symptoms that you're not having good quality sleep. Even if though you're sleeping like, let's say 8 hours, but you're still not feeling
energetic and happy.
Yes.
That means you're not sleeping well.
You're not sleeping well. You're struggling at sleep. So that's the time you need to go and check a sleep apnea specialist.
Oh, wow. Well, this was quite eye-opening and fascinating and something that we have never even dwelled into. Coming from the Desi community, हमको बुखार, सर्दी, खांसी, जुकाम होता है बस. ये सब तो पता ही नहीं था. And now you're the flag bearer of it here in the UAE. So wonderful meeting you. And thank you so much for taking your time out.
Thank you so much.
Is there anything else that you would like to add to it?
I would like to actually tell all the parents, especially teenagers who go through braces. There's one thing that I have seen. I've been doing this for 17 years now, and all these TMD and sleep apnea cases. There's one thing very common which I see is premolar extractions. So guys, please do not go for premolar extractions when you're going for braces because it's only making the jaws narrower. If there is a crowding, then I think it's better to address the root cause. Why is there crowding in the teeth? It just says that probably the jaws are not big enough and why the jaws have not developed big enough, I discussed about all the root cause. So it's important to look into the root cause and treat that rather than just pulling 2 teeth out, putting the braces and making the jaws even more smaller. So let's not do that.
Please make sure that you don't do that because I know people who have got braces,
Yeah.
and they're very happy about it because now their face is very narrow and long.
Exactly.
And they're doing it not only for getting the teeth in,
Yeah.
but also to look smaller,
Exactly.
which should not happen.
Which should not happen because,
Okay.
as I said, it can lead to a variety of very serious health problems later on in life.
So brace yourself with braces. I should have not said that. That's too funny. But thank you so much, yeah, Rashida. Wonderful having you in the studios.
Thank you so
and
much,
I'm
Tarun.
definitely coming for a consultation. And yeah, I hope that we see you on Dat Talks very soon with a more deep diving into this subject once we have some more clarity on my personal situation.
Thank you so much, Tarun, for having me.
Thank
it
you,
was
Rashida.
a pleasure.
Thank you.
Thank you.